Have you ever found yourself struggling to do something so simple? Maybe it's just lifting your grandchild, carrying groceries, or even just getting out of bed in the morning. Something you've done 100 times before. Chronic pain is one of the most frustrating parts of aging, and it can feel like your body is fighting against you. But here's the thing, pain is not a life sentence. In today's video, we're going to uncover practical tips and remedies that can help you take back control over your life and manage that pain so that you can do even the simplest things. By the end of this video, you have a toolkit of strategies to ease chronic pain. And I promise, this is not just about popping pills. Why does this matter? This is an important topic for so many of you because over half of older adults suffer from some form of chronic pain. But what a lot of people don't know is that pain management can be approached holistically: mind, body, and lifestyle. So let's dive into what works. I'd like to start by sharing a story that might sound familiar to some of you. Jane, a patient of mine, is in her 70s. Came to me because she had been dealing with severe knee pain for years. Gardening was her passion. She'd always said it was her therapy, her happy place. But when her knees became so painful that she couldn't kneel or bend down to tend her garden, she was, guess it, devastated. Can you imagine giving up something you love because your bodies just won't cooperate? It's heartbreaking, and it's a story I hear all too often. Common complaint in the clinic. Jane's story isn't just about physical pain, it's about emotional pain too. Chronic pain can affect our mood, our mental health, and even our relationships. How many of you have felt irritable or frustrated because your pain kept you from doing what you love? Or maybe you've pulled away from friends and family because it's easier than explaining how much pain you're in. Pain can be isolating, and I get it. Do you ever feel like pain has stolen a part of your life? Maybe it's kept you from traveling, spending time with loved ones, or even enjoying the little things like taking a walk in the park. If this sounds like you, stick with me because there are many ways to manage that pain and reclaim your life. Again, no pills needed. So, what exactly is chronic pain? It's a pain that lasts longer than 3 months. 3 months. Way beyond the normal healing time for an acute injury. The tough part is that it can be caused by a range of things, from arthritis to nerve damage to lingering effects from old injuries. But here's the tricky part. Pain is complicated no matter what the cause is. It's not just about the physical sensation, it's tied to how we feel emotionally when we're having pain and even to our stress levels. Did you know that chronic pain can actually rewire your brain? Yep. The longer you are in pain, the more your brain becomes hypersensitive to it. In fact, studies show that chronic pain can create pain pathways in the brain, meaning your brain starts to expect pain even when there's no direct cause. This is why pain management is so important. It's not just about managing the physical symptoms, but also retraining your brain. Something that's not very well explained in our clinic. Here's something interesting. Researchers have found that chronic pain affects the brain's gray matter. That's a part of the brain, okay, that actually helps with um, are responsible for processing information and emotions. In other words, the longer the pain lasts, the more it can impact your mood and decision making. Now, I know some of you may be thinking, how can I exercise when I'm in pain? But hear me out. The right kind of movement can actually ease pain over time. One of the biggest culprits of chronic pain is stiffness. And the less we move, think about this. Chronic pain is can be brought about by stiffness, stiff joints, right? And the less we move because we are stiff and we are in pain, the stiffer we become. It's like an endless cycle. Stiffness, pain, less movement, stiffer, pain, less movement, and it goes on and on. So, movement is very important. Sounds ironic, but movement is very important when we're in pain. What kind of movement? Low impact exercises like swimming, chair yoga, or even simple stretching can be incredibly effective. Jane, who I mentioned earlier, started with just 5 minutes of stretching every morning, and it made a huge difference. Do you feel like your pain gets worse after sitting or lying down for too long? Be honest. Yes, it gets worse, right? It gets worse after sitting or lying down too long. That's because our bodies are meant to move. Even if it's just a short walk around the block, it helps to keep our joints flexible and our muscles stretched and contracted. Some specific exercises I recommend for easing joint pain include gentle leg lifts while seated, arm stretches, and shoulder rolls. If you're able to, a simple 5 minute walk outside can work wonders for both your body and your mood. So if you are, or if you have a kind of job where you're just, really sitting just most of the time or most of the days, time of the day, you can still do some simple exercises while seated. There are chair yoga exercises. You can just do gentle leg lifts, right? Arm stretches. So I've mentioned shoulder rolls. But this has to be intentional. And if you are still with me listening to this video, the second tip I can share with you is heat and cold therapy. Alternating between heat and cold is a great way to manage pain. Heat therapy, like using a heating pad or taking a warm bath, can relax muscles and improve blood flow. See, the effect of heat or warm to the arteries or blood vessels is its dilatory effect. It dilates, it stretched out, and so it makes the blood flow more smoother because then you have enough bigger space for blood to flow because it has a dilatory effect. The hot, the hot or the warm compress, and to the muscles it can help relax, not contract. So that really can help with the stiffness. But on the flip side, cold therapy also has benefits in terms of chronic pain management. Using packs of ice or ice packs or cold compress can reduce inflammation and numb the pain. So two effects, right? For cold compress, reduce inflammation and numb the pain. One trick I often suggest is starting with 15 minutes of heat followed by 10 minutes of cold. 15-10. Heat, cold. This contrast therapy works wonders for people with conditions like arthritis. And I tell you, I once had a patient who swore by a simple hot water bottle for her back pain. It was just a simple change. But placing it on her lower back while watching TV or reading, it gave her significant relief. She didn't have to pop a pill, a pain pill. Tip number three, anti inflammatory diet. We cannot talk about pain management without talking about what you're putting into your body. Foods like berries, write this down, berries, leafy greens, and nuts are packed with antioxidants and anti inflammatory properties. The reason why chronic pain exists in especially the joints is because of inflammation, right? Long standing inflammation. So if we can make ourselves eat plant based foods that are very rich in antioxidants and anti inflammatory, like leafy greens, dark leafy greens, berries, and nuts, we are off to a better start. Omega 3 fatty acids, like we found in walnuts and flax seeds and chia seeds, can be especially helpful in reducing joint pain. And if you're going to ask me, what particularly what kind of food can we indulge more of that has the highest level of anti-inflammatory property? Here are a few. Again, berries, but at the top of all the kingdom of the berry kingdom, amla, or the Indian gooseberry, has the highest anti-inflammatory property in all of the berries. And you can buy that frozen or powder. And it has a bitter taste. But if you can add it to your smoothie, for example, or any beverage, that would be perfect. Now, another anti-inflammatory food that when you combine is really great for osteoarthritis pain are the tofu. When you add um, black pepper in tofu, or any soy product with black pepper, or with turmeric, that combination has shown to potentiate the anti-inflammatory effect of each of one of them. So then you get a very high level of anti-inflammatory effect. Now, have you ever thought about how your diet could be affecting your pain levels? If you haven't tried incorporating more anti inflammatory foods, now might be the perfect time. And I don't want to miss to mention this. Not only are you going to load your body with anti inflammatory plant based foods, you're also gonna want to what? Eliminate the inflammatory foods. And what are these? Processed foods, animal products. So we have the meat products, milk, dairy, right? Products, egg. These are just a few. But if you want to simplify things, I would you would want to avoid any animal products because they are mostly inflammatory. What's the point of loading plant sources of anti-inflammatory with anti-inflammatory effects if you're not actually uh, t- taking some effort in eliminating or decreasing inflammation in the body, right? So if you're looking for ways to start, try adding a handful of walnuts to your morning oatmeal or a sprinkle of turmeric into your dinner. These little tweaks can have big benefits. Or maybe instead of reaching out for a soda, um, why don't you make yourself a green smoothie? There you can combine the leafy greens, the ginger, the soy milk, and sweeten, right? You are really going to give yourself a big favor, much more than what the pain medications can do. Now, fun fact, turmeric has been used for over 4,000 years in traditional medicine for its anti inflammatory properties. Modern research backs this up, showing that a compound, curcumin, found in turmeric can help fight inflammation. That's why I mentioned a combination of turmeric and soy and black pepper. The anti-inflammatory effect of these three altogether far outweigh each and every one, each and every ingredient, each and every ingredient like a turmeric alone or a black pepper alone. Mix them up because these anti-inflammatories have shown to potentiate each other's effect. Tip number 4, mind body practices. Mindfulness practices can change how you perceive pain. We talk about the emotional effect of pain, right? Not just the physical sensation of pain, but the emotional effect of pain. And the reason why the same level of pain may be perceived, may be felt so at a different level of intensity among individuals is because of the way we perceive pain. Studies show that when we are mindful, we actually rewire our brain's response to pain. One of the easiest way to start is through guided meditation or breathing exercises. This doesn't mean sitting cross-legged for hours. It can just be as simple as focusing on your breath for 5 minutes. Let's actually try that right now. Okay, sit up straight, take a deep breath in, and exhale slowly. Repeat that a couple of times and notice how your body feels. As simple as deep breathing exercises done regularly is a medicine itself because it helps rewire our brain away from the pain pathway and decreases our perception of the physical pain. This simple breathing technique can help ease tension and refocus your mind. There's a growing research supporting mindfulness as a tool for pain relief. By shifting how we think about pain, we can actually lower the intensity of the pain we feel. Isn't it amazing? You can actually control how much pain you want to perceive of out of something. Rewiring the brain. And mindfulness meditation is a medicine in itself. Number five tip, sleep is so crucial when you're dealing with chronic pain. But it's often a vicious cycle. Why? Well, pain makes it hard to sleep, and lack of sleep makes pain worse, right? One tip that can help is creating a consistent bedtime routine. This could mean taking a warm bath before bed, using a supportive pillow, or even doing some light stretching to relax your muscles before sleep. Have extra sleep tips. If you wake up in the middle of the night because of pain, try keeping a glass of water or an herbal tea by your bedside to hydrate and calm your nerves. Also, consider trying a meditation app on your phone to guide you back to sleep. Just gonna go to YouTube and type mindfulness meditation for sleep, and you got tons of it there. Now, let's recap. Start with gentle movement, right? Because although pain can cause stiffness or stiffness can cause pain, if you allow your body to remain stiff by not moving, it's going to worsen the pain. So, gentle movement. Next is incorporate anti-inflammatory foods into your diet, plant-based sources, right? Alternate between hot and cold. Practice mindfulness, simple as deep breathing exercises done regularly, and prioritize sleep. These tips, along with the right medical guidance, can help you take control of chronic pain. Which of these tips do you think would make a big difference for you? Let me know in the comments, and don't forget to share this video with someone who could benefit from these tips. And if you found this video helpful, make sure to subscribe and hit that notification bell so you never miss a video on health and wellness tips tailored for seniors. Let's keep this community growing and supporting each other. Remember, pain is something you can manage. It doesn't have to control your life. You've got this. Till next week, my name is Dr. Idelita Hamis, and I'm the Lifestyle Changer MD. Bye for now.